Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer,
The dental hygienist
from Bulgaria,
Buffalo, New York,
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers,
10 Lumineers,
6 Lumineers,
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
and now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Good afternoon, everyone. We're going to place some Lumineers on our patient today, and he's got very well-maintained teeth, sound dentition, and that's what you need to start with if you're going to place Lumineers on a patient. So our patient today is a very well-maintained patient. He has no caries. He visits the dentist every 6 months, and he just wants his teeth to look better. Today we're going to place 8 porcelain veneers on this patient, and let's see, now we took impressions on you, and then we cosmetically contoured some of your teeth. Is that correct? And so once we had everything established the way we wanted, the gingival contours and everything, that's when we take the impression for the Lumineers. So we're going to begin now. Lisa has prepared these teeth, and what Lumineers allow you to do is to practice conservative dentistry. And I've never given a patient one single drop of local anesthetic to place Lumineers since 1983. So that's almost 25 years. And you don't have to either. There isn't one of you in this audience that couldn't do this procedure as well or better than I do it. 4 power is absolutely essential if you're working without anesthetic. And that's very important because I want to work without anesthetic because I don't want to give up that sensory mechanism. When you anesthetize a patient, you drill away the sensitive tooth structure, and then it wears off. You've got a patient that's having a lot of discomfort. Now, when you have 4 power, you're going to see better than any human being ever can. 2.5 power is what they usually try to fit us with. I happen to be an optometrist as well as a dentist. 4 power is essential. Yeah, I will be visually this far from the patient's tooth. Physically, I'll be this far away. So that's why you want to be using 4 power. The other thing that's important is getting a good impression. When the impressions come in, if the margins aren't sharp, then you got to call up somebody and say bring the patient back. But if you would pour the impression first, then you can check and make sure you're satisfied with those gingival margins before you send it in. Another area you want to look out for is prematurely removing the impression. We like to recommend the Invisalign technique, the double wash technique for taking impressions. If you take it out 30 seconds too soon, what happens? Distortion. How can you tell? Things don't fit. And so that's so important to leave it in for an extra minute, okay? And this is the way Lisa has everything set up. Now, that may look like a lot of things to you, but if you were to group them, it's only 4 or 5 groups of things. And plan on looking at these videos, taking a course, you and your staff, before you do your first case. You can see her putting the mouth guard on now. Okay, so she slipped that in, and she's put Porcelain Conditioner on the porcelain veneers, and she's put Serenade Prime on top of that conditioner. The conditioner is citric acid, and the Serenade Prime is the xylene. And we do that just before we place these. So that's really important. She's also polished his teeth with the Lumineers porcelain polishing paste. The reason we use that is because it has grease on the teeth. The grease is called plaque. And so by having an enzyme in the porcelain polishing paste, it gets rid of it. So when we etch and do surface preparation, it takes care of having a cleaner surface. You get a better etch. Now the next thing we're going to do is put on some paint-on dental dam. And that's all of the preparation we did was cosmetic contouring. Now what I'm doing is placing some paint-on dental dam all over the surface on the lingual where I don't want the ultrabond or the tenure to bond to these teeth. If you've got a lot of diastemas, you want to be careful that you don't get it going through to the labial surface, or when you polymerize it, it'll prevent your lumineers from seating. And lumineers don't fit real tight like gold castings do, because they're going to get filled in, that space is going to get filled in with the ultrabond. Close your eyes. The best way to protect your eyes is to close them. So I get a finger rest and place it and close my eyes, and then I expose it to the light for 3 seconds. We use the blue paint-on dental dam so you can distinguish it when you're removing it from ultrabond and tooth structure. Then I will test it, see if it's in a rubbery state. It's a real simple thing to do, but you'll see it pays off in spades, so to speak, big dividends when you're finishing. It makes it real simple. Close your eyes. And give me that light again here. I just a little spot. Close your eyes. And we'll let you take a look at that in a second. Now I'll let you take a look and see what we've just done. It took about 2 minutes to do that. And now we'll begin surface preparation. And I'm using Etch N Seal here. And Etch N Seal is phosphoric acid with aluminum oxalate in it. So if you're doing regular operative procedures and you get on the dentin, the aluminum oxalate helps seal the tubules and prevent sensitivity. Get a nice frosty surface. And then we're going to put a dentin bonding agent on there called Tenure AB. It's not light dependent, and it bonds to all composites. And one of the problems that a lot of dentists have when their veneers pop off is because they didn't get a good dentin bond, didn't get a good conversion. So we just put a lot of this on here. See, it's just one step. Okay, so now we've done the surface preparation, and we're going to try on a couple of these Lumineers now. Left central. Lisa always calls out the name of the tooth. Now I'm doing the try-in with Ultrabond try-in paste. Now, Ultrabond try-in paste is exactly the same composition as Ultrabond, except for one thing. It doesn't have any activator in it. Now, if you look at the patient's left tooth and the patient's right tooth, you can see a different shade. And the reason is that when light goes through a medium, it continues going forward until it exceeds its critical angle. And the critical angle in this case is the air between the etched surface of the porcelain and the tooth. Now when we put the try-in paste in, it gets filled in. Now we'll let the patient select the shade. Do you like the shade on the left better or the shade on the right better? The left? Yeah, that's what I thought you'd like. Now we're going to take Tenure S. Tenure S is a HEMA, and Lisa uses that to remove the try-in paste from the Lumineer. The Tenure S will cause polymerization of the Ultrabond try-in paste. And I'm going to use the Limi grip to deliver the left central. Okay. And it's just a little suction right there. Left lateral. And the right cuspid. We're going to take the 2mm tip and get some of these to set so they won't go falling off. And I want to see excess everywhere. Close your eyes. Okay. And we just brush off some of the excess. And the reason we want to put the tenure S on is twofold. One is that you want to protect that prepared surface, because whatever gets there first, resin or contamination, wins the race. Now we take the 2mm tip and set the rest of these. Now remember, we didn't cure for that tacking on the left central, because we didn't want to polymerize that and interfere with seating the rest of these. So now we'll wipe off the excess on the interproximal areas. It simplifies finishing. And I'm just wiping the Ultrabond on the lingual side toward the incisal, and it fills all the gaps. Now we'll take the 5-second application of the 9mm tip, go on each tooth. Close your eyes. Close your eyes. Now I'll let everybody take a look at what it looks like on the lingual. So we'll just pop that off. And we're going to take the Shear 349 instrument. This is a very important instrument to use. We'll use it for removing the Ultrabond off the labial surface. And we'll take some of this out of here. And where we had the tenure S, it's beginning to polymerize. See how nice those gingival areas are? They're all cleaned out because we got out that blue paint-on dental dam. Okay? Okay, now what I've got is a football-shaped diamond here, American football. And I just go back on the occlusal surface and I start removing the excess Ultrabond and porcelain. And I blend, open real wide, Now we're going to go to a 12-fluted burr, and I go around these gingival margins. And this is where, remember, you're working on a patient without anesthesia. Now what I'm doing is removing all of the excess Ultrabond. Remember, I want to see excess Ultrabond everywhere. And remove all of the Ultrabond. My objective is to get a stress-resistant, non-microleaking aesthetic restoration. And all I'm doing is taking this Ultrabond out very slowly, very meticulously. And I've got a long, narrow diamond. Now I'm coming in and I'm blending that porcelain to the tooth, just the way enamel blends to dentin. I'm just removing the excess here. So it's kind of like in reverse. Rather than cutting away the tooth, we don't take anything away from the tooth. Then we just take away what we don't want to leave on. We'll probably spend another 20 minutes finishing on him. And before we do that, we're going to check the occlusion. See how they have definition and aesthetics? Grind your teeth a little bit. Let's take a look here and see what we have. We got marks on the natural tooth. The natural tooth got a little Ultrabond on here. Natural tooth, natural tooth, natural tooth. What I want to guard against is having prematurities on porcelain, because that can cause it to chip. See this right here? That lateral incisor and the cuspids like to knock off the distal of laterals. You don't want to shorten the tooth, you just want to narrow that incisal table. So we're going to take and have you grind around a little bit, not to break anything, but just grind around all over. Any place you can feel lumpy, why go there. Oh, that's terrific. Open. Now we're going to take a look. All right. Now I'm going to go back in with the football-shaped diamond, and I'm going to remove those areas of prematurity. And I'm just taking off these incisal edges, narrowing them, shortening them. Now let's try that and see how that feels as you grind around. So you just take the series saw and go through there because we've removed all of the ultrabond. You don't saw, see that? If you got a lot of resistance, stop sawing and start rocking. See this right here? We open that contact. And I'm just going to go around and open all the easy contacts. See how that goes through there? Don't saw and put a lot of pressure because then when you slip through, you'll cut the interdental papilla. And then we'll take the series sander. Orthodontists use this a lot to open embrasures and change dimensions of teeth. Okay. So you just take your time and you open these up. And that's the reason we didn't get through that central, is because we had just a little bit too much ultrabond in there. And the ones you don't open today, you have the patient back in a week, and that's when I do my final finishing. So there we go. We opened 3 contacts for you. Look at the floss going through. See? And we're going to do that to all of his teeth. And I'm going to let our patient take a look at this. He hasn't had a chance to see it yet. Smile real big. I'd like to welcome you to come out here to Santa Maria to visit us, take the over-the-shoulder course. So I'm going to wish you goodbye and good luck, and give us a call or stop by and visit us whenever you get on this area. Okay. Goodbye.
Well, I have a marketing services business, and I'm often involved in training and consulting, and sometimes do on-stage presentations and do public speaking. And often those things will get videotaped, or DVDs will be built. And I got a chance to see one of those DVDs, and I suddenly didn't like my appearance, and I particularly didn't like, the way my teeth looked when the camera got really close. And that just made me think, I need to do something with the appearance of my teeth and my smile. I didn't really want to go through all the pain that you have to go through when you get your teeth ground down and all of that procedure, and it just didn't seem like it was something I was really interested in doing at the time. But when I heard about Lumineers, that seemed like a process that made a lot more sense. Looked like you got tremendous gain without any pain, and that's really, I think, what made me make the decision. There was no pain. There was no discomfort. It's a very atypical process in a dental chair. Mm-hmm. Why anyone wouldn't want to do that and wouldn't want to go through the Lumineers process, I don't know, because the results is fantastic. It's sort of like, getting glasses in an hour. You can get a perfect smile in an hour. That's about as good as it gets.